The administration's announced a number of public-private partnerships geared at bringing the federal agencies and private industry together to develop medical countermeasures. The NIH is at the helm of most of these efforts. Um, how is the agency's role different in the RADEX and active partnership and Operation Warp Speed? Collins?
So yes, we are very much a fan of partnerships to get science to happen. When I had the privilege of leading the Human Genome Project, I learned how much can be gained by bringing groups together that have different skills and talents and not worrying too much about who's going to get the credit, just get the job done. More recently, I've had the privilege of leading several of these public-private partnerships focused on trying to develop the next generation of therapeutics for diabetes, for Alzheimer's disease, for rheumatoid arthritis and lupus, for Parkinson's disease, for cancer. And those have turned out to be enormously productive by getting the best and brightest scientists around the same table to design the work, hold themselves accountable, and make sure all the data is accessible to everybody. And so when the COVID-19 crisis came along, it was clear that we might benefit from that same kind of model. And by talking to my colleagues in all sectors, we did decide that this was worth a try. On April the 3rd, which is just 34 days ago, convened senior leadership of pharmaceutical companies, of FDA, CDC, BARDA, and the NIH, and the European Medicines Agency, and came up with a series of things that we thought could be done better as a partnership than either of the sectors or either of the companies or institutions could do on their own. And that's what ACTIVE has become. And I must say, it has been astounding to see the way in which people have rolled up their sleeves and plunged in to this effort to advance therapeutics and vaccines for COVID-19. Some of those previous partnerships I mentioned took a couple years to sort of work out the details and finally get everybody sitting down at the same table. This took 2 weeks, and on April 17th, we announced the launch of this enterprise. And it has been 24/7 for these working groups that are trying to knock down the barriers that might otherwise get in the way. The RADX effort is not the same kind of partnership. I might call it more of a bottom-up kind of partnership, in the sense that the talent and the innovation and the creative ideas about new testing platforms is largely coming from small businesses. And so they become our partners because they're feeding these ideas into the Shark Tank. Of those 1,087 that I told you that we've already received as far as responses to the solicitation, 2/3 of those are from small businesses. There's also a wonderful input from academics and a few middle-sized businesses as well. That's just the kind of thing you'd like to see for this kind of a partnership, which is going to be intensely competitive. So yeah, I guess in my time at NIH, 27 years now, I learn over and over again, if you want to get something done, find all of the potential contributors who have skills, talents, energy, motivation, and resources, and let's do it together. And that's certainly what we have to do at a time like this with this global pandemic all around us.
Thank you. I now have a question of kind of a who's in charge question. We're having to scramble to catch up, and that means conducting early stage research at the same time that we're trying to move products through the advanced development stages. The public health emergency MC mission statement identifies the National Institute of Health taking the lead role in the early research, and BARDA is taking the lead role in advanced development and manufacturing. Should NIH or BARDA have primary authority for advanced development and manufacturing support or scale-up?
I think this is what we're talking about at this hearing, the handoff that we are making sure happens in this space. We're really good at getting those early ideas started, figuring out how technologically they can be advanced. But when they get to the point of being ready for a real commercialization scale-up, BARDA steps in with all their skills. Gary, you may want to say more about how that works.
Yeah, I appreciate that, Francis. So this is not the first partnership between NIH and BARDA. We have partnered over the past decade or more with the National Institutes of Allergy and Infectious Diseases, transitioning vaccines and therapeutics for some of the greatest threats that our nation faces, such as chemical, biological, radiological, and nuclear threats, and pandemic influenza. So I think this is just a building of that natural partnership that occurs. We work hand in hand. You saw on Dr. Collins' slide that BARDA is integrated into the active partnership. You saw on the slide that I presented that it is a whole of government where everybody is integrated and working across government, sharing information and helping to develop those medical countermeasures.